Hey, Demetria Davenport here, the massage doctor. Today I want to talk about pneumonia. You guys may or may have not heard that Whoopi Goldberg, she had pneumonia and she contracted sepsis, which is an infection in the body. She went to the doctor. She started off with a little cough, act like it was a cold. She treated it. It went away, but it came right back, and then she had a cough that wouldn't go away, and then also she had some fatigue and other issues that she was dealing with. So when she did go into her doctor for a checkup to see what was going on, in the midst of her examination, she had sepsis. So the doctor called 911 so they can rush her to the hospital so she would not go into septic shock. And what sepsis and sepsis shock can result in an infection anywhere in the body, such as pneumonia, influenza, or urinary tract infection. Many people who do survive this are left with life-changing effects such as post-traumatic stress disorder, chronic pain and fatigue. Organ dysfunction means that their organs don't work properly, and or they may have to get certain part of their bodies amputated. With pneumonia, you can have pneumonia and not even know that you have it. You may have symptoms and you may not have symptoms, but some of the symptoms for pneumonia are fever, coughing with phlegm, shortness of breath, sweating, shaking, chills, headache, muscle pain, fatigue, and chest pain with breathing. Also, people who are at risk of catching pneumonia are the elderly, the very young, people who have recently had a cold or influenza, smokers, having a respiratory illness such as chronic obstructive pulmonary disease, exposure to certain inhaled toxins, having recently had a surgery, and people in intensive care units are at risk of developing pneumonia. There are three different types of pneumonia. You have your bacterial pneumonia, which can be treated with antibiotics by prescription by a doctor. Then you have viral pneumonia, where antibiotics don't work for that, and you just have to stay hydrated and drink plenty of fluids. And the doctor may prescribe antiviral medications for you to take, but it's not common. And then you have fungal pneumonia. Fungal pneumonia is treated with medications called antifungal medications. So guys, make sure if you do have pneumonia or you've been diagnosed with pneumonia, but you haven't been hospitalized, if your doctor is telling you to rest and take in fluids and hydrate yourself, you must do that, because pneumonia is very deadly. Also, I know someone who did have pneumonia, and they had to be in the hospital for several months to get the fluid off their lung. And also with pneumonia can either be in one lung or it can be in both lungs, guys. So make sure that you're wrapping up in this cold season. Make sure you're keeping your face covered with a scarf or something to cover this. Keep your neck and chest wrapped up also with a scarf, and make sure you guys are putting on a skull cap. Even though you may be running from your car to your house or vice versa, make sure you guys bundle up, because pneumonia will take you out of here. I hope this information was very helpful to you guys. The massage doctor signing out. Mwah! Love you, bye. And also, if you are experiencing any of these symptoms, please contact your primary care physician and or go to a urgent care and or the emergency room. Again, the massage doctor signing out. Love you guys. Bye.